Here, Dr. Veer Pushpak Gupta, I want to ask you, how are patients accepting this vaccine in the United Kingdom? We know we are looking at a lockdown kind of a situation and long wait over the last 10 months for a vaccine to somehow pull countries out of this entire loop of infections and rising COVID cases. There seems to be a ray of hope. But are people going in willingly or are they waiting? How is the United Kingdom looking at the demand, going forward? Are people really waiting to see how other people react to it, or are people just queuing up for the vaccine?
Well, first of all, thank you very much for having me on the show today. As you know, UK started the vaccination program about almost a month ago now with the Pfizer vaccine. So they've been doing vaccinations for 80 and above care home residents, as well as care home workers, as well as frontline staff in the NHS. And it's been going on for about less than a month now almost. And it's worked very well so far. We haven't had any major incidents or any major worries that have come out from the UK population in terms of side effects. The frontline staff are getting vaccinated. I think 1 million doses of the Pfizer vaccine have already been given. But the excitement around AstraZeneca and Oxford is for two main reasons. And one of them you already mentioned, which is the fact that it can be stored at much higher temperatures compared to the Pfizer vaccine, which allows it to be shipped to the frontline practices and GP medical practices that are in the United Kingdom, so that the doctors themselves and the nurses in those practices can then vaccinate the patients that they see. But the other important factor to consider is obviously the pricing. It's being given at £2 to £3 per dose to the UK government. It's also being given at quite a cheap price to the developing countries. And it's the only vaccine in the world today that has promised that it will not increase its prices to developing nations. And I think nations like India can benefit from it immensely. India has a vast experience of vaccinating millions of people with the polio vaccine in the past, and I think they can do it effectively in the future as well.
So, Dr. Guleria, there are questions that normal lay people have, and questions are: if you've had the COVID infection before, are you still eligible to get the vaccine? What are the kind of reactions you should expect, given the fact that you might have some antibodies in your body? These are common questions that come up, and also the question is, how much would be enough to break the chain of infection? Do we have to vaccinate the entire population of India, or is there going to be a strategic number? If we have them vaccinated, then we will be able to break the chain reaction.
So I think the first question is regarding those who already have COVID-19. Now we must understand that there is a large number of people who have mild or asymptomatic disease and may not even have been tested or diagnosed to be having COVID infection. Therefore, first to find out who's had COVID infection by looking for antibodies will become a task in itself. And there's really no contraindication for giving vaccination to those who had COVID in the past. Therefore, I think everyone who is in the high risk category, based on your priority list, will be vaccinated even if he's had mild or has the significant COVID infection in the past. If nothing else, it will give a booster dose as far as your antibody response is concerned and be able to protect you even further. So there is no sort of criteria that if you've had COVID, you will not be vaccinated. Second question regarding the what was your second question? I've sort of missed out on that.
The second question that I asked is, how much is the critical mass that needs to be vaccinated to break the chain?
So the vaccination has two basic strategies. One strategy is to decrease mortality. And to do that, we will need to vaccinate our high risk group, the elderly, those with comorbidities, and that is one of the priority group. The second group is that we need to break the chain of transmission. To do that, we must understand that there is a significant number of people who already have immunity because of mild to moderate or severe infection and have recovered from COVID. Once we vaccinate another group, we will achieve a sufficient mass of people who have immunity, which could be what you call herd immunity. If we achieve that and that number goes up to 70 to 80%, then that would give us sufficient confidence that we will be able to break the chain of transmission. So we will have our cases coming down because the virus will not be able to spread from one individual to the other because of a large number of people having immunity and not allowing it to spread. At the same time, we would have vaccinated our high-risk group who have a higher chance of having severe infection. So once we're able to do that, and it doesn't mean that we have to vaccinate every single citizen, once we're able to do that, that we vaccinate our high-risk group and are able to create a sufficient mass of people who are vaccinated so as to break the chain of transmission, I think we will be in a very good position.
Dr. Gupta, the new mutant strain of COVID-19 that created a bit of a panic last week, does that complicate matters, or is this Oxford, AstraZeneca, and of course the Pfizer vaccine that was already available in the UK, both of these or either of these would be enough to handle the new mutant strain?
Yeah, look, we have a pretty dire situation on our hands in the United Kingdom at the moment, and all fingers point towards this new mutant strain. And the new mutant strain obviously has allows the virus to attach on to our lung receptors much more effectively than was previously thought, and that's why it increases transmissibility by about 70%. So if you think about the virus infecting 1 to 4 to 8 to 16, that will then be increased by 70%, taking the R number up high, which is what is happening in the United Kingdom. And I think what Dr. Guleria mentioned is very important because that chain of transmissibility, the transmission has to be broken at some point. And we're not seeing that in the United Kingdom at the moment. We had 50,000 cases in the UK yesterday alone, 440 deaths. And I think that the increase in the transmissibility would also then inadvertently affect the mortality and morbidity of the patient in the hospital. Because if the patients that come into the hospital cannot be escalated to ICU care because of lack of ventilators, of lack of beds, then they will obviously not get the adequate care that they require. So we need to effectively vaccinate about 60 to 70% of the UK population to keep that R number below 1 permanently. And that is the challenge right now for most medical healthcare systems in the world, especially in the United Kingdom and even in India.
Dr. Guleria, as far as India is concerned, we have 20 identified cases of the new mutant. Some contact tracing is a bit haywire here and there. Do you think we'll be able to control the situation and not go the UK way?
So I think it's very important that we be vigilant and start being proactive rather than waiting for a spike of cases to happen. There is a lot of learning and warning that we've got from UK. So 2 or 3 things are very important. One is at an individual level. If we are able to have COVID appropriate behavior, everyone wearing a mask, maintaining physical distancing, avoid having crowds, especially during the New Year Eve, and regular hand washing, we will be able to prevent the transmission of this virus from one person to the other. It still is a droplet infection. The route of spread is the same, and therefore that becomes more important. From the, let's say, policymakers and scientists' point of view, we have to have a very aggressive network where we can do the genome sequencing and pick up any variations which is there, either in people who are coming from UK or from abroad, but even among our own population. And if we find that there is a cluster developing somewhere, a certain increase in the number of cases happening or increased mortality in certain area, we must do testing for genome sequencing there to see whether there is a new variant out there and develop a containment policy so that we don't allow this to spread to other parts of the country. We have to be proactive so that the gains that we've had over the last few months in our decline in the number of cases, decrease in our mortality, high recovery rate are maintained over the next few weeks, because then when we just have the vaccine around the corner. So if we are able to maintain our low numbers for the next few weeks, and then we start vaccinating a large number of our population, I think we will be in a much better position. So this is the time when we need to have more aggressive COVID appropriate behavior, very good surveillance. The SARS-CoV genomic consortium, which is now active, has to start looking at all the samples and make sure that we don't let this variant